I'm Robin Tull, Chair of the Chesapeake Hospital Authority. The Chesapeake Hospital Authority Board exists to support the health and the welfare of the citizens of the City of Chesapeake and the region. Every 3 years, a needs assessment is completed to identify the most pressing healthcare needs and gaps in our community. Because of this assessment, we determined that an expansion of hospital services in the area of cancer treatment, heart health, and behavioral health was necessary. In addition, since we are known as the place in Hampton Roads for the delivery of healthy babies, we wanted to expand our mother-baby health care services too. Dedication and service to the community is as important to our values today as it was in 1976 when the hospital opened its doors. We are an independent community-based hospital committed to the delivery of the highest quality of care to our citizens. We understand our history and we want to build upon it. It began with a grassroots effort to build a hospital so our residents would have quality health care near where they live. As Chesapeake has become the second largest city in the Commonwealth of Virginia, we are building upon our legacy with an expansion of the healthcare services our residents will need now and the care they will need in the future.
Hello, my name is Dr. Tony Citrone. It's my distinct privilege to chair the Chesapeake Regional Healthcare Foundation Board. Chesapeake Regional Healthcare is an independent healthcare organization where providers, staff, and volunteers come together uniquely supported by the city government to provide a first-rate healthcare service for residents to access in their hometown. Please join me and my fellow dedicated Foundation board members in support of Chesapeake Regional Healthcare.
Hi, I'm Rick West, Mayor of Chesapeake. Chesapeake Regional Healthcare and the City of Chesapeake have an incredibly unique relationship, created out of necessity when others chose not to provide adequate medical services to our citizens. The city has grown and our citizens' needs have increased, but Chesapeake Regional has always been there. That is why, if you talk to a Chesapeake resident, they will tell you Chesapeake Regional will always be their first choice.
Hello, I'm Amber Edgett, Chief Nursing and Chief Operating Officer at Chesapeake Regional. We are excited for the opening of our new critical care tower. In that tower will be 72,000 square feet of new care space. The tower will consist of a 30-bed critical care unit with all of the latest technologies that will allow us to care for our most acute patient population. We will have a 28-bed step-down unit with all the modern conveniences of patient and family-centered care. And this unit will also be spacious and have all of the greatest technology available at this time. The 6th floor will have a 36-bed neurotelemetry unit that will allow us to provide more acute services for our growing neuroscience population. We are excited to be able to offer patient and family-centered care in our new critical care tower to the members of our community.
Hi, I'm Reese Jackson, President and CEO of Chesapeake Regional Healthcare. We broke ground in January 2020. And even though we had planned for this several years ago, none of us would have known what to have expected this past year, so tumultuous, and such a reminder of the importance of the provision of healthcare services to our community. Our community, by the way, has been so gracious to us, recognizing us as healthcare heroes, and for that we are very, very thankful. When we make investments in our community, these things don't happen that often. They're very rare investments like this critical care tower. One of the things that I really like about these topping off ceremonies is that it gives our employees the opportunity to come out. Employees that have worked here for a number of years, employees that have many more years to work. But we are all in this together. Why? Because we are built to care, and we will do so proudly for many years to come. Thank you so much.